You're listening to Seattle Real Estate Podcast.
All right, my friends, what are we talking about today? The CDC. Remember when they were all over, oh yeah, you got to wash your hands 18,000 times a day. You got to use a lot of disinfectant. Clorox is your best friend. Gargle Lysol. I mean, just all that ridiculousness at the beginning. And we're like, is this really working? Is this really necessary? Here's the short answer, brought to you right on the Seattle Real Estate Podcast. No. CDC is saying, telling businesses to end the hygiene theater, all of that stuff. We know we made you guys do that. We recommended you do that. So all of your governors and your mayors, they all jumped on the CDC bandwagon, and everybody talks about the CDC as being just the ultimate authority. Well, they're kind of throwing out guidelines willy-nilly because they don't know either. And now they're basically saying, end the hygiene theater because the risk of being infected with COVID through surfaces is low. It's low. All those surfaces you cleaned. How many times did I clean the damn desk out in the office? Not enough, probably. Because I kind of got to a point where I'm like, you know what? I just don't think Rona is crawling all over this bad boy. I think it's us breathing on each other for a consistent amount of time. And as long as we're not doing that, I'm okay with it. So you just didn't have all these cases where like, yeah, I wasn't in physical, contact with anybody. I got it off of a counter at the restaurant I frequented. So now the CDC is saying, end the hygiene theater. Let's get past this. We know we told you what you were supposed to be doing at the beginning, but now we understand better. End the hygiene theater because the risk of being infected from surfaces is low. Low. One of the things that has really annoyed me is these big spraying things that spray a bunch of chemicals into the air in like a gym environment. And then those of us doing cardio in that area suck a bunch of chemicals into our lungs. Isn't that good for us? Go to the gym, get healthy, or get sick from the chemicals they are pumping into the air. Now, there's no easy way in between that, is there? Right? And they need to spray down these surfaces, these machines, or do they? I wipe down my machine religiously mainly because I sweat a lot when I work out. If I'm going hard, and I don't want to put my sweat in somebody else's workout environment. But I know there's been hundreds, if not thousands, of people on that same very machine that have done the same thing. So I don't clean it up before I get on there because I just don't think that I should need to do that. I'm okay sweating on it and then cleaning up my own sweat. If that is too much information, sorry about that. But these machines that we've got at my club that go through and just basically punch a bunch of aerosol disinfectants into the air, and then we all breathe it heavily doing cardio. It just seems like a terrible idea. And maybe that's where we're at. We're like, okay, we're making people sick doing this, right? Is that a possibility? Let's see, you put disinfecting chemicals into the air and then breathe them. How does that go? Probably not great. And that's what we're realizing, right? Okay. Before we jump into that, I'm reading a Daily Mail article. I know Tim Pool reads a lot of Daily Mail. I don't, just because they don't cover the topics kind of in depth the way I want. A lot of it is theater, but this one I'm going to read. For those of you guys who sent this to me, thank you so much. I'm reading a ton of content you guys are sending because you guys are we're all kind of on board. It's like, okay, there's that storyline. Yep, this is what we're doing. I don't read a lot on the CDC or the Rona because I think so much of it is just overblown and not necessarily. And I think we really overreacted to this virus coming along. I think our political leadership did for a number of different reasons, of which I'm not going to get into. But I think there was a lot of political stuff going on with this coronavirus. And I just want it to be over, and I want to move on with my life, whether it's good or bad, or corona-laden infected services, just crazy. Okay. Before we get into that, and I read this article, which I need to do because you're tired of the intro. If you're new here, thanks for joining. My name is Sean Reynolds. I own a couple of real estate companies, and I read the news. I had a comment from somebody I got one more comment. I promise I'll read this story. I had somebody say, hey, you should hire a handful of journalists and go out and do what Tim Pool is doing. And I admire Tim Pool greatly. I mean, he's created a niche that other people like me are like, okay, I think I can replicate some of that, not his intuitive analysis of the news, but he is going out and he is literally hiring journalists to fact check stories to get the news. You guys watch me because I read stories that I think are accurate, and then I give you my opinion. And and part of my deal here is that I am also a business owner, and I've still got one foot in the business world, well, a couple of feet in the business world, and read you the news at the same time. So I'm different than a Tim Pool or a Dave Rubin or, any of those guys, because I literally have these other businesses going on that take up a lot of my time because that's my livelihood, and I read this stuff. So I'm not 100% into the podcasting, but pretty darn close, and will be at some point in time. But I've got these ongoing businesses, and that's what I bring to the table is, my opinion here, talking about this. Sean, shut up on your other stuff and read the story. Okay, here we go. CDC officials have updated guidance to advise against disinfecting surfaces regularly. They're now telling us, don't do it. The agency deemed the risk of contracting COVID-19 from surfaces low. The CDC still advises using detergent, soap, and water in households and businesses, but disinfectants are only necessary if there's been a suspected COVID case. How many times have I cleaned the door knob on the front door handle because the CDC had us scared out of our pants that if somebody comes in and opens the door to your office and then touches their eyeball or whatever, they get sick, and then you're going to be blamed. You as the owner of the company. Oh man, the amount of ridiculousness we had to go through to technically open up to the public as a small business, as a professional business, it was insane. I mean, insane. Companies that deal with the public on a regular basis throughout all this, nuts. The restaurants, the oversight for their safety stuff. I mean, we had to put up a bunch of signs and I've got masks and all that stuff out there. I was a good boy. I followed the protocol. Well, I mean, most all of it, a solid percentage I did. But I think we're kind of beyond that now, and we're looking at the CDC going, well, they're telling us not to routinely clean all of our surfaces. In fact, it might be hurting some people. Wild, right? It's time to stop obsessively Clorox-ing every surface and object, U.S. health officials announced on Monday. Do this, don't do that. We're constantly being told that. Here in Washington, so here's another I'm going to go down another quick rabbit hole. Our governor realized that based on the data and the science, that most of our counties with an uptick in cases, not deaths, but cases, an uptick in cases means that following his program, we should probably be reverting from phase 3, which has, less restrictions than phase 2. We should be going to phase 2 based on the data and the science. That's legit where we should be. Do you know how you get around that? Because we all want to keep these businesses going. We kind of realize, crafty, if we close down, this is not going to go well. The sentiment from the small business owners and the general public, this is not going to go well. So what does our governor do? He literally, the goalposts are here. He takes them and moves them and says, you know what? Based on the data and the science, here's the thing. Now, normally, these counties would be shut down based on the data and the science. But now it's not just one criteria that they have to fulfill. It's 2. We're going to do a double header here. We're going to change the criteria for which you get moved from phase 3 to phase 2. Problem solved. It's kind of like taking a crime and making it no longer a crime. No more crime. Problem solved. Why didn't we think about it in the beginning of the coronavirus shutdown? I don't know. And that's too easy, right? This stuff just, I almost don't pay attention to the COVID-19 stuff anymore because I feel like so much of this, as reasonable people, we kind of knew up front and we're like, do masks really work? I'm waiting for them to say, yeah, you know what? Masks really only helped out like 1.6% of the transmission get effectively stopped. So in reality, 98-point-something% of all your mask wearing was a waste of time. I'm just waiting for that to come out, right? I think that's coming. We just don't know when. It's when everybody has lost total interest in the coronavirus and we're on to something new. We're under a new variant. We're on to something else. An army of sanitizing robots, round-the-clock cleaning staffs, and UV lamp-wielding workers is being called off by the CDC, which has deemed the risk of contracting COVID-19 by touching surfaces low. I love reading that because it just makes me feel redeemed for what I think. Schools, businesses, and households have spent millions collectively over the past year in an effort to step up cleaning practices and make their spaces safer, or at least make them feel safer. Love that line. Do you feel good? I do. Is there any logic or fact behind your feeling? No, but it's how I feel. Therefore, this is what I'm going to do. I just want to feel better. I don't need to have any data or science that's real behind it. I just want to feel good about how things are going. So I wash my hands a lot. I take the Clorox spray and just spray the F out of something on the desk. You know, it has given rise to the term hygiene theater, referring to the suspicion that most of these high-tech sanitation practices are a waste of time and money, as reported by The Atlantic. Okay, I don't think they're a total waste of time and money, but the level to which we were told you've got to do this to 15 days to flatten the curve turned into a year. The Centers for Disease Control and Prevention's latest guidance update confirms that the benefits of constant scrubbing and disinfectant dousing robots do not outweigh the risks of contracting coronavirus from a contaminated surface. Okay. So we don't really need to do that anymore. I think there's so many things that we're going to be like, oh, yeah, remember when you couldn't get a mask? Well, that's okay. You didn't wear one? That's okay, because they didn't really work. That's on the horizon, guaranteed. All right. These Daily Mails have a lot of information and a lot of ads. So I got to kind of scroll through here. People can be infected with the virus that causes COVID-19 through contact with surfaces and objects. However, evidence has demonstrated that the risk by this route of transmission is actually low. How many times am I going to read that? A lot. You know why? Because I feel vindicated. I didn't really do that much cleaning because it seemed kind of silly. This was explained by CDC Director Dr. Rochelle Walensky during a Monday White House press briefing. Cleaning with household cleaners, such as soap or detergents, will physically remove germs from surfaces. This process does not necessarily kill germs, but reduces transmission risk by removing them. Where do they go? What happens to them? If you're not killing them and you're just moving them, where are you moving them to? I want to know. I don't really care. I've been all over. I've been in gyms where we didn't wear masks, where we didn't really clean much down. We just kind of believed that the Rona wasn't that big of a threat, and we did our thing for months and months and months. A whole bunch of us should have got the Rona from that gym. We didn't. How come? Maybe because a lot of us are healthy? Maybe because there was an underreporting requirement? I don't know. Maybe because we all had positive mental attitudes about the fact that, hey, if you don't think we're going to get it, then you probably won't. But if you hunker down in your house and just have fear institutionalized into your thinking that you're going to catch this bad boy, maybe that has something to do with it too. I don't know. But my experience has been, I've been all over during this whole thing, traveled a bunch, just don't really care. And, I'm not trying to put people in harm's way that if they get it are going to die. We know who those people are. They should be out of the way of this thing. But dictating to the rest of us that you got to do all this other stuff when it doesn't really make sense and none of the data or the science actually support it, it's kind of where I sit. Disinfectants ranging from Clorox wipes to medical grade UV lights and robots that automatically use the sunlight like radiation to kill germs. They use that to kill germs, not just move them. The pandemic saw sales for the full range of disinfectants skyrocket. Remember that when you couldn't get a hold of any of these cleaning products? Customers bought up Clorox wipes faster than grocery stores could stock them. Clorox president Linda said during a May Good Morning America segment that her company had seen an unprecedented spike in demand for wipes, up 500% versus a year ago. Shocking. Now, when something as big as the CDC says, wipe everything down that you own 45 times a day and do this, this, and this, then yeah, you're going to probably sell some more wipes, right? A flood of disinfecting innovation brought an army of UV lamps to schools and airplanes, and even saw the invention of a wristband that sprayed disinfectant like a gadget designed for a germophobic Spider-Man. Do you remember Spider-Man had that thing on his wrist? He'd like flick his wrist and you'd have that web go out. That was about the last that I really kind of followed the superheroes. I liked the Hulk and Spider-Man. I thought those were good storylines, good, clean American fun. And the Hulk especially. I watched the Hulk with Bill Bixby before he died of cancer. I watched that religiously as a kid because I loved the transformation of when Bill Bixby would get upset. Mild-mannered Dr. Bill Bixby, whatever his name was. And then his eyes would go all red with those contacts, and then he'd get all jacked up because he turned into Lou Ferrigno, who was probably one of the greatest bodybuilders ever, but he always played second fiddle to Arnold in the era of the golden era of bodybuilding down in Venice Beach, which is now overrun with homeless encampments. Even the pickleball courts down there in Venice Beach and Muscle Beach are homeless encampment tent city. Between flights, airplanes got zapped with newly installed UV lamps. And the New York City subway system saw an unprecedented overnight shutdown during which train cars glowed blue with the high-power sanitizing systems. But in most cases, this isn't necessary, especially given the spike in children ingesting dangerous chemicals seen during the pandemic. How did that happen? We had a lot of cleaning products out. It's a numbers game. You leave enough containers of toxic cleaning products out, some kid is going to get a hold of that, put it down. Oh, gross. I think of some of the things that my kids, ingested, like chew spit. One of my oldest kid got a hold of grandpa's chew spit. Oh, not good, right? Just kids, just going to take a drink of this. I think my ex-wife, put her finger down the kid and throat and just get him to throw up. Just, gross. But kids do stuff. They don't know. They can't read. They didn't get the memo from the CDC. So you got kids ingesting a bunch of chemicals and not good. Disinfecting uses a chemical product, which is a process that kills germs on the surfaces, Dr. Walensky explained. In most situations, regularly cleaning surfaces with soap and detergent, not necessarily disinfecting those surfaces, is enough to reduce the risk of COVID. However, the CDC still recommends using disinfectants in schools or anywhere that a person suspected or confirmed to have COVID-19 has been. All right. The same will apply for airlines. All right. But I flew in last May. I went down to Arizona to get a haircut. No, I just wanted to get out of Seattle because it was so oppressive here and it was so cold and just miserable. So I did that. And man, they had all kinds of safety protocol for the airplanes because we were just new to the idea of getting on this big flying tin can. And is it safe? I mean, I always kind of thought so anyway, especially if I'm wearing a mask. I kind of feel like I'm not breathing on my neighbor. I've sat next to one person in the 6 flights that I've taken since the coronavirus broke out. And you know what? I just kind of feel like a lot of us are going to get vaccinated and we're just not going to worry about this stuff anymore. CDC also now warns against using cleaning products that became popular during the pandemic, such as electrostatic spray. Don't do that. Not good. In most cases, fogging, fumigation, or wide area electrostatic spraying is not recommended as a primary mode of disinfection and has several safety risks to consider, said Dr. Walensky. All right, no more mass spraying of all the machines at the gym. No more mass spraying in a restaurant because you're getting it on people's foods, right? Many of these cleaners contain chemicals that are highly toxic to people. Let me read that again, just for kicks. Many of these cleaners contain chemicals that are highly toxic to people. No kidding. I am shocked. The cleaners that we use to get rid of a virus, they're toxic to people. We can't just ingest them. Let me do a line of that cleaner, said nobody ever, right? I mean, let me take a highball of that cleaner. No, they're bad for you. It's terrible. You do that, you're going to get sick. You're going to get sick. Not good. In most spaces, there is a greater risk that someone in the room will inhale the harmful chemicals than there is a risk that someone has contaminated the room with COVID-19. What? Yeah. We're at that time period in the coronavirus. The election's already happened, where we're just going to have story after story of this. And, all that stuff that you did at one time, guess what? Yep, unnecessary. And we knew that. I think a lot of us just knew that. This doesn't make any sense. What they're telling us, this does not compute. But, clean is clean. I did my part. I can look back and go, okay, yeah, but I did my thing. I tried to obey as best I could, tried to be a good little boy as best I could. But man, I'm going to read about this when these stories come out. So keep sending me this kind of story. I will keep covering it because I think there is a lot of stuff out there that's going to come out on the tail end. And it'll be like this. Hey, do you remember when we recommended 2 masks? Well, we've got data that says 2 masks don't do anything more than 1. And even 1 mask doesn't really do much. We're still not sure why the coronavirus transmits the way it does. And then we're also going to see a bunch of stories about the death cases and how, unfortunately, we attributed a lot of those things with people with pre-existing conditions. We wanted that federal funding. You're going to see a bunch of stuff about that, right? And you and I aren't going to really care, but we're going to look back and go, I thought that all along. I'll keep covering it right here in the Seattle Real Estate Podcast. So keep sending me the stories. Much appreciated. All right, I'm out of here. I've got another good one. I'm excited to do as well. I can't really remember what it is, but I'm sure it's another stellar storyline here in the Seattle Real Estate Podcast. Thanks for being here. Thanks for watching. Love to have you share my content. That's the best way to get the word out there so that YouTube believes, hey, this is worth pushing out. Let's do a little of that. All right. Thanks again for being here. I'll catch up with you guys on the next one. Stay safe. Until then, goodbye. Don't forget to subscribe to our channel and hit the notification bell so you'll know when our next video is out.